Alright, so what we have here is the SH6-7. This is a debridement instrument, and specifically, it's known as a scaler. It has a simple shank. The shank is rigid, which means that it's used to remove moderate to heavy calculus. It's double-ended and paired, meaning that it has two working ends, and each end resembles one another. It has a triangular cross-section with a tip end and a 90-degree angle from its face to its terminal shank. Basically, what that information means is that this instrument is utilized supergingivally. Because of its triangular cross-section, if we were to use it subgingivally, we could risk harming our patient or causing them pain or trauma. This instrument has two usable cutting edges per working end, meaning that both edges of the instrument can be used to debride. This instrument is utilized in the anterior region, from canine to canine, in both the maxilla and mandible. It's adapted from the midline to the mesial interproximal space, or from the midline to the distal interproximal space. So the SH6-7. Now we're going to look at it clinically.
Okay, so 6-7, you're going to again place the leading third of the instrument, midline of the tooth, remaining supragingival. Short overlapping strokes. And working into the midline of the proximal surface. So for maxillary anteriors, you're going to be seated at 12 o'clock. As you work from canine to canine, you're going to ask the patient to rotate towards you, just to bring the tooth that you're working on towards midline. And just making sure that you're rotating the instrument with your thumb and index finger as you get towards the line angle to maintain adaptation.